Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle live in studio. Love to take your phone calls today. It's glorious outside. Spring has sprung, finally. Keep your fingers crossed and it stays with us and doesn't go away again. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied, you've come up with the same old, same old. What, you're still looking? Well, here's the opportunity. Here's how we do it without drugs, without surgery. And we have a topic for you based on the season. It is spring and what comes along with spring. It's called allergies. You know, your nose is already getting plugged up, you're coughing like crazy, your eyes are burning, you can't swallow, your throat's sore. Sounds like a cold, but it's not. It's really all that nice stuff that's out in the air right now. With the beauty comes a problem, and many of you unfortunately suffer dramatically from those types of conditions. So we're going to cover those a little bit today, but we're going to cover them more specifically and in detail this Wednesday evening, April the 9th, at the Roselle Center for Healing. And guess what? Dr. Matt Adams is going to be your presenter and my guest today in studio. So we're going to talk about springtime allergens or anything else that you'd like to talk to about in addition to that. Having said that, Dr. Matt, welcome again.
Thank you very much.
It's good to have you always. Thank you for, when I'm kind of going all over the country and so forth, you've had the opportunity to sit in. I appreciate it. So the microphone is now very common to you.
No, we had a good time. It's different in this seat over on this side now.
I know, because I get to do the interrogation. I know. One of these days you guys are going to get me into the hot box, and Dr. Pina keeps saying, we're going to do that again. The last time I gave you a break and I let you just kind of coast in there. So, but, as long as I can keep putting it off, we'll be in good shape. But this Wednesday evening, you're going to be talking about springtime allergens. The 9th of April, God, this year's going by quickly. I used to say when I was first in practice, if I had 6 months to plan something, it was like all the time in the world. Now 6 months, I go crazy. I actually freak out. It's just like it's not enough time.
You freak out?
A little bit.
Okay.
I mean, you see it on a regular basis in the office sometimes. You just have to watch your two little daughters, those beauties that you have.
Yeah.
And, how they kind of lose it. That's what happens to me now with 6 months.
Okay.
Not really. Anyway, let's talk about allergens and, the things that are making people miserable right now. And unfortunately, there's way too many people that are sensitive, are allergic to allergens, and there's a whole lot that can be done about them. Let's start with this. We talk about seasonal allergies. And they can happen actually twice a year. They can happen this time of the year, and they can happen in the fall. My question to you is, what makes the spring so unique?
What makes the spring so unique?
Relative to the allergen patterns.
Oh, well,
because we got ragweed in the fall. In the spring, we've got other junk.
Yeah, we got all kinds of pollens. And out here, your car turns yellow. There's stuff everywhere that's springing forth and getting in your passages. And then we just got over winter where we've, been through all those different seasons and eating all kinds of things, and our immune systems are down because we're not outside and it's cold. And now we get hit with spring and the pollen, and we want to get outside, and our body isn't quite used to that yet.
It's one of those stresses.
Oh, exactly.
It's thermal stress is part of it. But, with spring comes not only the pollens and the dusting of the cars, but also the fungus and the mold and the mushrooms and all that stuff that springs up into the grass, and people end up having problems that they normally wouldn't experience any other time. And, let's go through the symptoms, Dr. Matt. Patient comes in, we've already started seeing them in the practice. What do you see? How do they present? What are the profound symptomological representations of this season?
Yeah, so a lot of it is probably what the listeners right now are. They're trying to suppress the cough that they can feel in their throat right now, and a little bit of runny nose. Now you're snoring a little bit more at night. You're driving, and every once in a while your eyes get watery. I mean, those are very common symptoms of the springtime allergies. There's also you're a little more tired than you were before. That starts to show up a little bit here and there. Or maybe you're not as motivated. You don't sleep as well. Other things like ear infections with kids, those start showing up too. So maybe you start having some joint pain. So you have the common ones that most people think of with allergies. They're like, oh, I've got allergies because I have these symptoms, and other people don't think they have allergies. But there's a lot of other symptoms that you can talk about that people don't associate necessarily with allergic reactions.
There's an interesting phenomena as well this time of the year, is because everything is kind of blossoming and blooming all over the place. You have these invaders, these pollens and these mold and these spores that are all over the place. But, what people don't understand, when they are treated for this, they also carry bacteria. They also carry microorganisms. They also carry things that we wouldn't have in our membranes otherwise, particularly coming off, as you said earlier, off the winter season. All of a sudden it hits, and unfortunately, because we've had such a lousy, long, terrible winter, I think that all of a sudden now within this next week, 10 days, we're going to see things just kind of explode, and people are going to be running in our office very quickly in exploding natures. But, medically, they're running to the drugstores. They're trying to put the stuff out with Afrin, and they're trying to put it out with all types of antihistamines and steroids and the like. So, Dr. Matt, when a patient comes in and, how do you distinguish, if you would, with Mrs. Jones is in front of you, how do you distinguish the pollen, the mold, the fungus, so forth? How do you treat this? I mean, medically, they're going to drug this person. They're going to suppress the reaction, the immune response, and that's what it is. The body's trying to protect itself. How do you identify the process?
Well, first, you were asking a lot of questions to begin with. You got to find out when it started. I mean, if it's been going on all winter, then there's possibly an allergy that hasn't been treated, and it's been continually plaguing them until their system keeps getting lower and lower and lower, making it easy for this springtime stuff to kick in. And then there's some people who, as soon as the springtime comes around, they start feeling it. So you kind of get a better idea, okay, it's more of this type of allergy because of this time, or this one for this person. Then you ask questions about, have you ever had mold in your house? I mean, is there a constant attack of problems with mold or fungus in your home, and it's finally coming out? That's a tough one, because to try to visualize a patient, there's so many directions you can go, especially in our office. There's so many ways you can look to identify what the causative factor is, from chemical, emotional, and structural problems that can lead to the allergies coming through.
So many patients come in the office and they've been to their doc and they've had every allergen test known to man, and most of them are skin tests called the RAS test.
Yeah.
And they have their skin, pinpricked, and they insert all this stuff in their skin, and they go to the doctor and say, well, you're allergic to this, you're allergic to that. And bottom line is, why are you allergic to any of these things to begin with, but from tree pollens and grasses and so forth. The problem is, in seasonal allergy reactions, is that you have a mechanism to protect you. But there's so many other pieces that most physicians don't take into play. One is all the fertilizers, all of the toxins that are put upon these plants. And now they come out of the soil as well, and they become part of the transport of these things that people are sensitive anyway. So you have a patient complaining that they can't breathe. They're, oh, by the way, here's, I know we're off of Don Bennett's show, but if you want a great springtime investment, what you do is you invest in anybody that produces things like Zyrtec. But you do it before spring hits, because, people are going to go buy those things. It's a seasonal, never mind. I'm out of my field now. Sorry, Don. But anyway, seriously, it's like going into the holidays. You buy the retail outlets along about, the end of September, 1st of October, and get there, and everybody buys, and they report, and the stock goes up. But let's talk about, these presentations. Why do people get so susceptible? And that's because all of these things we're talking about, Dr. Matt, are symptoms.
Well, they're susceptible. It's all about the immune system and what's helping and supporting the immune system. The immune system is there whenever we are exposed to something to get rid of it and to fight it. And so, naturally, if you get fungus or something in your body's going to go, okay, you're not supposed to be here, and I'm going to get it out. If you're constantly bombarded by things on a regular basis, then it gets hyperreactive. And so now you get the basic fungus stuff in your body goes crazy, and you get that big histamine reaction. Everything just flares up. Or then, because of you're so hyperactive, now you start getting normal things, little pollens that we're used to, and all of a sudden your body goes crazy on those too. And so now you start getting these constant hyperreactions to the the bad stuff and the normal things that everyday people can handle normally.
So super domino effect.
Super domino effect. We call it, and then that stresses your adrenals. We talk about adrenals a lot on here. And so as your adrenals get stressed, because they get called into action, and then they start to get fatigued, and we call those vicious cycles in that domino effect. So it's basically the domino effect that never ends. It just keeps going around in a circle.
The interesting thing is that people who take GERD medications to suppress hydrochloric acid production, they actually are much more susceptible to allergens in the fall and in the spring. And we talked about that on the way up because any of the antihistamines will do the same thing, as well as protein pump inhibitors. What happens is that you need hydrochloric acid in your stomach to fight the airborne pollens and all of the molds and all the spores and so forth. If you don't have it, your body can't break it up. And if you can't break it up, then your immunological reaction, your different cellular responses can't get in and deal with these things. So now, you've lost the first line of defense, if you will.
Yeah.
It makes it far worse. So we see this. We see people coming in and say, "Oh my God!" So it's one drug on top of the other, to try to fight this thing.
And then the environment in your body gets suppressed, and it just makes a really nice environment for those molds and funguses to keep growing, causing more damage, and we get more problems. But yeah, and that's the funny thing about, they're on all these antacids, and then they start taking those different drugs, antihistamines, like you said, do the same thing. So now we have a double effect, keep decreasing your ability to digest food. And we've talked so many times about the GI tract and how it's our first line of defense. And so now you've got a double effect, suppressing digestion. You suppress the digestion, you cause more damage in the digestive tract, and so now you have stress in the digestive tract, you have what we call leaky gut, which we might talk a little bit more about, where now things start getting through into your bloodstream before it's fully broken down, and now you start getting more food allergies on top of that, and plus, other bacteria. And so you just, like I said, we're going back to the whole domino effect of all the things that are taking place from the decisions we make with food on top of all the drugs that we're starting to put in our body.
888-630-9625. That's 888-630-9625. That's how you reach us here. If you'd like to see us or talk to us outside of this office, meaning the radio station, you call us at 703-698-7117. Dr. Mathew Adams, my guest in studio, your host this Wednesday evening, April the 9th. We'll be talking about springtime allergens and all the allergen connections that are there. It's a subject that if you're having any struggle with, you really need to attend this class, and all you need to do that is call 703-698-7117. That's 703-698-7117. Tell my staff that you want to be there. We don't require funding or cash out of your pocket, but we do require a reservation. So give us a call and join us, and Dr. Mathew Adams will take you through step by step and show you how to reverse this nonsense and make life a whole lot more simple and enjoyable, and you're going to coast. We'll be right back. Don't go away. Dr. Tom Roselle.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education. Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're talking about springtime allergens. You know, all that stuff out there that's making you cry and choke up and have chest pain and ache a little bit and not be able to sleep as well. That stuff is what we're talking about. 888-630-9625 this Wednesday evening at 7:30 p.m. at the Roselle Center for Healing. Dr. Mathew Adams, my guest in studio, your host, will be presenting this topic. So if you'd like to join us, or you'd like to figure out how you can get off of Advair and the Zyrtex and all the other steroids that they put in your body, this is an opportunity because, my friends, it can be done. It's something that you can turn around and make a difference in your life. You need to call us at 703-698-7117. That's 703-698-7117. Tell my staff that you'd like to be there. We do require just a reservation and a phone number that they're going to ask you for so they can call you back and confirm the class and make sure that you're going to be there. You're welcome to bring anybody you like with you, but we still need that reservation. Before we get back into the program, let's go to the phone. Shirley, how can we help you? Thank you for holding and being patient.
Oh, you're quite welcome, Dr. Roselle. Thank you so very much. I will make this as brief as possible. My sister lives in Long Beach, Long Island, New York. She was diagnosed with MS in 1994. She's doing okay with that. The main question now that is really troubling me is she has a horrible allergic reaction. They don't know what it is. Her allergist doctor has been doing all type of tests, but she's having the attack so bad to her face and lips swells inhuman, and it gets down in her throat where she is whispering.
Shirley, do you know if it's triggered by food or is it triggered by the environment, or don't you know?
They don't know. I mean, like now the doctor put her on some over-the-counter medication. She was trying to test her to see where was it coming from, but they say she was allergic to a lot of things, but to pin it down, but she was having these severe attacks so bad until they just, right now they got her on some kind of over-the-counter.
I'm sure they do. They're probably going to drug her with it. Let me kind of say this to you, and then I'm going to give you a way that we can figure this out for her. One is that if it affects her swallowing ability, it can be something called eosinophilia esophagitis. Esophagus is the food tube, and it can cause it to inflame. Any exposure, generally with food, but also airborne things can cause the same thing.
Would you repeat that name again?
It's called eosinophilia esophagitis. Now, what you need to do, Shirley, is send me a note on email. Go to drtomroselle.com, and I'll send this to you. Now, I also want you to get a hold of me online, and I will give you 2 or 3 referrals where your sister is that they do similar work to what we do. and she'll be able to contact that. So you have that one problem can be there. She also can have a fight-flight stress reaction causing the adrenal system not to work, and not enough hydrochloric acid in her stomach. Her intestinal tract may be something called permeable, which Dr. Matt and I are going to get into in the second half of the show. And so what happens is anything she's exposed to, anything that she eats, gets into her body, and instead of being fully dealt with because maybe she doesn't have enough hydrochloric acid or the intestinal system is not balanced properly, now her body is going to react to it. So it's difficult to tell you what to do with her, except for generals. Get her off of, the garbage, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. Get her away from anything that's moldy, dairy products. Get her away from cheeses. Get her away from peanuts and peanut butter. No alcohol whatsoever. No gluten, no breads, the yeast in baked goods and so forth.
They got her on some kind of diet. She's eating gluten-free bread. But she said this morning, I don't know, I'm doing everything that they're telling me to do, and her neurologist says it's not coming from the MS. But, it's to me, it's worrying. It's worrisome because it's getting down in her throat.
Yeah, it's telling me that her adrenal system isn't clearing and her liver's not clearing. There's a lot that can be done. She needs somebody to, that can help her, that understands the work that we do. But Shirley, give me a note. Tell me, reference our conversation here on the radio, and I will send you data. That you can reference, and she can contact some people. Shirley, I appreciate your phone call.
Thanks so much.
You're welcome, my friend. We're coming up to the break, and we've got to pay attention to some very important people. So stay tuned. Don't go away. We're going to talk more about allergy reactions, and the next half, Dr. Mathew Adams is going to get into the intimacies of that. And don't forget, this Wednesday evening, April the 9th, 7:30 p.m. at the Roselle Center for Healing. Love to have you. Just call 703-698-7117. We'll be right back. This is Dr. Tom Roselle. After 35 years of practice and almost 750,000 patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
If you're looking for the best in natural health, wellness, and green living products, shop the Roselle Web Store on Amazon.com. You'll find a variety of products and resources that are designed to help achieve an ultimate state of health and wellness. Shop the Roselle Web Store on Amazon.com today. Visit drtomroselle.com and click on Roselle Web Store. That's drtomroselle.com and click on Roselle Web Store.
Join Dr. Tom Roselle for a movie viewing of Ageless Health, the special. Ageless Health is a hard-hitting documentary based on the modernization of holistic health, natural care, and integrative medicine. You won't want to miss this Emmy Award-nominated documentary film. Proceeds benefit Caring for Others, Ltd. Ageless Health, the special, showing at the AFI Silver Theater in Silver Spring on Sunday, May 4th at 2:30 p.m. For tickets and information, visit agelesshealthmovie.com.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live in studio. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. We're talking about springtime allergens. And my guest in studio, your host this Wednesday evening at 7:30, Dr. Mathew Adams. And that's the topic, allergens and how to avoid them. You go into your doctor and you say that you're wheezing and you're short of breath and, you can't get it together, and, your throat's sore, and, all of a sudden, all kinds of things. And they put you on medications like Zyrtec, but also Advil if they think that you're, moving towards an asthmatic type of situation. And then they give you the warnings. Don't take if you have congestive, pulmonary disease or chronic pulmonary disease, obstructive pulmonary disease. They tell you if you have any heart problems, don't take it. If you, by the time they're all done, you shouldn't be on the medication. But your doctor says, well, don't worry about it. Just take it anyway. We'll monitor you. Well, then you get in. You take all those medications, your steroids and all kinds of things, and you get rashes and hives, and your face and your mouth swell, and so does your tongue, and you increase breathing problems, and your blood pressure goes up, and you get irregular heartbeat. You get chest pain. You also get tremors. You shake, and you get a little nervous. And you can't figure out why you're nervous. And then as it progresses over a period of time, taking all these wonderful medications, you have upper respiratory infections. You have, increased throat irritation. Well, that's why you took it, right? And then you have hoarseness and voice changes, and you took it for that too. And then you have thrush in the mouth. That's fungus. You're a fungus patch. You have all this white stuff growing in your mouth, and you end up with bronchitis. Well, remember, you took it because you couldn't breathe. And then you cough, and that's one of the symptoms of springtime allergens. And then you got headaches, and so, Dr. Matt.
There's a lot of sarcasm in there.
Really? Me? Sarcastic? Yeah. Are you kidding me? Never. Bite your tongue. Go ahead.
Well, you're naming all these different symptoms, and I'm thinking about all the different experiences I've had with people with these and being able to help them. My wife, for instance, had a lot of these different problems. One being asthma that she had developed through fungus in the past, black mold that her school had, and how much chiropractic itself doing adjustments and stimulating the nervous system has really helped her to where she used to, if we got around anything like a perfume or cigarette smoke or something, it would just set her off and she couldn't breathe, to now she can be outside and handle that okay. It's amazing how the nervous system is affected by those. And then I think about, what else did you mention? You spat off a whole bunch of stuff right there.
Yeah, so, sore throats, can't breathe, got fungus in your mouth.
Okay.
And you're trying to fix the fungus outside, right?
Okay, so now we've got people coming in with allergies to different foods that they're showing up that are normal good foods, and you find out that there's other toxins that they're not getting out of their system, and maybe there's a heavy metal that they're exposed to that it's not getting out, and so that's causing a hyperreaction to certain foods. I've experienced that before. Your liver has to do a whole lot of work whenever you've got things coming. Your liver is your filter, and so with any filtration system, if it gets backed up, then it's got to come out somewhere. A lot of times causing rashes and hives. So whenever you wake up in the morning, you've got little red spots on you or on your stomach or on your arms, and you're trying to figure out, where did this come from? Well, it's your liver got too taxed and it's not able to handle it. And that could come from all those medications, because your liver has to process all those medications you put in your body, or it could be from all the stress, because stress causes a lot of different hormones to be produced in your body, and your liver has to process that.
Dr. Matt, you touched upon a subject that we see, you and I and guys in our office, we see a lot of people walk in, they say, what's this all about? And usually in the fall and the spring, it's skin rashes. All of a sudden they show up out of nowhere, and they said, what's going on? And you mentioned the little bitty, things that they wake up, a little spot here, a spot there. But more importantly, it is consistent with the exposures. They go outside, they come back in, they look like somebody beat them. They have welts on them, or they have these areas of crustaceans. How does that happen? Why the springtime? Why the fall?
Well, just like we talked about, you're getting exposed to these things in your body. Your body's already having a tough time processing all the different toxins and pathogens and things in your body already. So now you expose it to these allergies outside that it's already having trouble with, and so you get this hyperhistamine reaction. So that's going to open up your pores anyway, because histamine just kind of opens up everything. And now your liver just can't handle it. It's too much stuff for it to handle, so it gets backed up. And so it's got to come somewhere, and a lot of times it'll come out through the skin, all these different toxins that are building up. Plus, if you're having some digestive issues like constipation because of all the other medications you've been taking, so now you not only do you have the backup in the intestinal tract because it's not getting out that way, now you've got the backup at the liver, and that's where they come in. They come in with these things, and now I'm asking them questions about how they go in the bathroom or things like that. And they're looking at me like, why are you asking me that? And I've got hives. My hives are right here. Why are you asking me about my digestive tract.
This Wednesday evening, April the 9th, 7:30 p.m., you get to listen to this guy, and he's going to walk you through why you react, and not only walk you through why, but how to fix it. And if you really like to end the process once and for all and really, do something that can stabilize where you are and then progressively, step by step, make it better, don't neglect this class. This is one that you really need to come to. 703-698-7117, 703-698-7117. Tell my staff you'd like to be there. You need a reservation, but that's all you need. We're located on Route 50, just off the National Capital Beltway, about a third of a mile on the right-hand side, in the Red Cross building. Real quick, you can get there fast. We're going to take a few phone calls. Debbie, how can I help you? Thank you for calling. Appreciate it.
Yes, I was wondering, what are the symptoms of acid reflux, and if you have it, how do you treat it?
I'm glad you asked that question because it's kind of crazy. Besides, obviously, the burning sensation, that's very typical with acid reflux, and you get that burning sometimes anytime. When you're bent over, when you're sitting around, when you're on your computer or on the telephone, it just kind of burns. Or also chest pain, also hoarseness, also laryngitis, also asthma type of feelings. I mean, does it sound like, it's crazy? Well, see, the problem is that any symptom can be any symptom associated with any condition. So the symptoms are, in most situations, inconsequential. Burning is a very specific symptom that's associated with acid reflux. The problem is it doesn't answer the question, why is that? Where did it come from? You have a stomach, and you have a food tube called an esophagus. And the esophagus, this food tube, comes down through a muscle before it attaches to the stomach called the diaphragm, which cuts you in half. Okay? And it helps you breathe and helps you do all kinds of things. Now, there's a valve. It's actually muscular rings at the top portion of the entry to the stomach. And if that muscle, that diaphragm, isn't working the way it's supposed to, then it can put pressure on that valve and cause it to open up when it shouldn't. So you get a pushing of acid or the digestive things that you should have in your body. You need them because otherwise you can't break up food. And what makes that not work properly, neurologically, you have a nerve from the upper portion of your neck called the phrenic nerve. It's made from the second and third nerve roots in your neck. They go all the way down. They touch the stomach. You have nerves from your back that go there. You have a cranial nerve, one from the brain that goes down called the vagus nerve. It touches that. So any of those guys can misfire, causing that muscle not to work. You can have a deficiency in something called phosphatase. And that's an enzyme that will cause that muscle not to work, other muscles as well. You can have the muscle jammed or the stomach jam up because you were lifting something, or you're not in shape. You don't have good muscle tone. The problem is that when they treat this thing medically, they knock the stomach acid out. They suppress it. Now, when they do that, what happens is you can't absorb things. You can't absorb protein. You can't break it down. You can't absorb calcium. You can't get it into the form that your body will absorb it.
It also keeps the valve open if you suppress the acid, because the acid causes the valves to close so that acid doesn't keep working its way back up.
Absolutely. That's exactly how it works. So the problem is that you have to identify the why. So how you treat it without drugs is you treat it through different systems. You find out which one's not firing. If it's neurological and the nerve is insulted because the spinal system is misaligned, you realign manually the spinal system in a very gentle way to allow those nerves to fire properly. If there's an imbalance of bacterium in the intestinal tract and you identify that, you put the good bacteria. If there's allergy reactions that will cause the stomach to burn, you desensitize the way we do the allergens, not putting you on medications forever, but desensitizing them. And generally you're going to treat it multidimensionally, and you get really excellent results, Debbie. It's one of those things that can work nicely.
Okay. Thank you.
Thank you for calling. Appreciate it. Colette, thank you for calling. How can we help you?
Yes, I have my sister that she's taking Boniva, and I know that Boniva is not good. She had cancer in her breast cancer done a couple of years ago, and they put her on Boniva. Is there anything other than Boniva? Boniva is no good?
Yeah, I mean, obviously Boniva is one of the, as far as I'm concerned, one of the most deadly drugs out there because it causes something called osteonecrosis, which means that the bone begins to break down as well. It actually does opposite. People lose their teeth in their jaw because of things like this. The problem with, Benasto, Boniva, Fosamax, Actonel, they're all the same type of thing. They're a group of drugs that are supposed to slow the loss of bone, but the problem is that bone does two things. If you're healthy, it breaks down. It's called osteoclastic formation, and it rebuilds. It's called osteoblastic formation. And it slows down the stoppage of the osteoclastic formation, and it doesn't pull the dead bone out. It leaves it there. So subsequently what happens is the bone becomes more brittle. It actually causes more of what it's trying to stop, if you will.
Yeah.
So you have to look at, why the patient isn't working. It could be a hydrochloric acid insufficiency, not enough stomach acid to absorb things. It may be they're eating the wrong things and their body's too acidic, so they're pulling calcium out of the bone. It can be they don't have enough vitamin D or the right forms of calcium. It could be not enough magnesium, something called K2, which we're finding that has to be there. Selenium, strontium, all these things help bone and maintain bone integrity. So it's not a straight up take this, like you see all the marketing, take this calcium with vitamin D and some magnesium and you're great. Not so much. It may be a sedentary lifestyle. But the good news is, Colette, most of the greatest majority, over 90% of them, can be stopped and begin to reverse themselves as well. So love to help you any way that we can. You can always get a hold of us going to drtomroselle.com, and I'll send you information. Or just give us a call, and you can go through our nutrition department, and there's a whole lot. Tell your sister-in-law to come in, or call us, or write us, and more than happy to help her out. Appreciate the phone call.
Thank you.
You're welcome. Dr. Matt, let's get back into the process of how do we handle these allergen reactions, and let's look at it from why is the intestinal tract so important? We talked a little bit about permeability, and what does that really mean, and what we're talking about?
Yeah, and just going on with these callers, when we're talking about, it's all about rebuilding from the inside out, and gut permeability meaning things get out of the intestinal tract easier. The intestinal tract is made to absorb the food. It goes through little pores, little holes, and it gets into our bloodstream after it's broken down, so our body can use it. So if something gets through before it's fully broken down, then the body's going to recognize it as foreign, and it's going to attack it. So that can include different foods we eat. It can include the bacteria that we ingest, the fungus we ingest or breathe in. So all these things start getting into our intestinal tract. One, they cause damage because we don't have enough stomach acid or we're eating bad stuff. And now they're getting through into our bloodstream before it's ready. So then our body goes, hey, you're not supposed to be here. Our immune system kicks in to attack it. And so now we get this big reaction, but it's not enough to break it down. So now it starts filtering through the bloodstream. It calls the liver, say, hey, liver, we got to take care of this. The liver can only do so much. And so now it's still through our bloodstream, and it starts to absorb in different tissues in our body, which can cause inflammation or pain. And now you get a reaction, and you're going to have your normal, like, sneezing, coughing, but sometimes you get this reaction where all your joints start to hurt too. Well, that's because you've got all these pathogens or whatever absorbed into your tissues, and they're going to react all at the same time. And eventually, over time, it can start causing, we call autoimmune problems, where now your body starts attacking its own tissues because it's been sitting there for so long, and now your body's like, well, I'll just attack all the stuff around it. It all looks the same now.
There we go to that domino effect again.
Yeah, exactly.
It's like one after the other after the other. And, unfortunately, we see that, and then you add medication to that, which further shuts down immunological reaction, and now you've got a problem that is over the top.
Yeah, you have to start from the beginning. You can't just start with the symptoms, because the symptoms are a trickle down of something that happened a long time ago. So you have to go back to the beginning and start to heal that and rebuild the body from the inside out. But you can do that. You can reverse these things. You can feel better.
888-630-9625. That's 888-630-9625. That's how you reach us here on the program right now. And to attend Dr. Mathew Adams' presentation on springtime allergens, all you have to do is call us at 703-698-7117, 703-698-7117. We'd love to have you. These classes are set up for your education, so you can learn how to handle things, so you can take care of yourself. And, if you're having a problem and you're on medications and you really wonder if you can get off of them, this is an opportunity. Why not take it? It's not going to cost you anything. Come on by. Our goal is to serve, educate, and empower you on your quest for the best health that you could possibly achieve, that your body's capable of doing it. That's why we do these programs. That's why we're here every Sunday. That's why I'm out lecturing all the time. I just came back from North Carolina. I was out there talking to some people and talking about the possibility of things that can happen with allied health sciences at this one university. So who knows, all I know is our job is to help you. Dr. Matt, there's a lot of people that are sitting down there and say, what can we do to even blunt the symptoms of this, just without even fixing it? Is there anything that we can do? And there's lots of things people can do. And, one of the things I tell my patients is that remember, and going back to the GERD, you need acid in your body. Mm-hmm. And it's an old naturopathic remedy. Take 2 tablespoons of an organic apple cider vinegar on an empty stomach, providing you're not allergic to it, on an empty stomach every morning. And then start eating local bee pollen. But you got to start slowly, because if you're allergic to pollen, you're going to allergic to any kind, but you're going to a little bit of time. And you're going to start like 1 or 2 granules, going to 3, going to 4, to the point where you add it up, and then pretty soon you can get to a teaspoon of it. And you'll find that you'll actually begin to desensitize the body because you're taking things that actually work. So there's a lot. If you want to clear your sinuses out, there's something called a neti pot. And you can get that at most health food stores. So there's real quick things that people can do. But I know this Wednesday evening you're going to get very intimate on a lot of these treatments, things that people can do for themselves, but more importantly, how do you stop it? How do you stem the tide? And that's going to be an important piece.
Yes. No, yeah, and I like what you talked about. That's a great way, like the bee pollen. Every time you move to a new area and you get new allergens, it's important to start doing those things early so you can prepare yourself for all the things that are about to come in and start bothering you.
Yeah, it's every area is unique. It's pandemic. To the area means it's kind of consistent to the area that you're in. So, but there's so much you can do. You just have to identify where'd you come from, what you've been doing, what the system's doing. We're coming up to a break. We have to pay special attention to the people who bring you Dr. Tom Roselle live. So don't go away. We're going to be right back after some very, very important information. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live every Sunday, 12 o'clock, same old, same place on your dial. We're here for you. That's why we continue to do the process, because we have to educate you. We want to empower you. We want to lead you to the area that you need to go to maximize your health. And you reach us here at 888-630-9625. And you reach us either by computer at Dr. Tom Roselle or rosellecare.com, ROSELLECARE.com. You can do it that way. And the phone number, which you're going to use to register for Dr. Matt Adams' presentation on springtime allergens this Wednesday at 7:30 p.m. The number is 703-698-7117, 703-698-7117. Gina, how can we help you? Thank you for calling. Hello, Gina.
Is that me?
Hi. Dr.
Hi. I'm having a number of the issues that you're talking about, and not specifically the runny nose and all like that, but also I've been fighting an issue on my own because I was having severe skin problems, and the dermatologist was giving me tubs of triamcinolone and prednisone products and whatnot. Now I've gotten to a point where I don't think I can deal with this on my own anymore.
Tell me what's going on. I hate to push you. We're coming up to the end.
I'm having severe pain on the lower right side. I don't think it's appendicitis. I get blown up with a lot of gas, and
do you notice
I have radiating pains up my neck into my head.
Do you notice any foods that bother you right away?
Beets maybe.
Okay. How about sugars or grains? Things like wheat or rye or barley.
I stopped eating all the gluten grains.
Okay, great. So that's going to help, because what happens is you end up with a huge histamine reaction due to glutens, and you get into antihistamines that makes it worse. But it could be food allergens, and any type of food allergy reaction ultimately decreases your body's immune system. But the food allergy reaction comes from either neurological, biochemical, environmental stress patterns, the things that we've talked about on a repetitive basis. Mm-hmm. You have any kind of allergic reaction, your immune system creates something called IgE antibodies, and the body creates different types of these antibodies, but most of them are your first line of defense. That's your mucus is your first line of defense. Your spit in your mouth, the mucus that's in your intestinal tract. And what those are called IgA. And if that IgA system, which is supported and brought about by the adrenal glands, the fight-flight system, then if that's weak, you can't produce the stuff. You can't defend yourself. So what has to be done is you have to find out if that system is working or not working. You support that, and things begin to turn around. Listen, Gene, I've got to drop your call. We're closing out the program. Get a hold of me. Give us a call. Love to talk to you further on the subject. Dr. Matt, real quick, 30 seconds, wrap it up. Tell me why everybody should attend the class on Wednesday evening.
Well, I think we talked about a whole bunch of things that everybody's heads are spinning, trying to figure out what we were just talking about. Allergies are complicated, but they can be fixed. There's a lot of systems involved. A lot of things inside have to be rebuilt. And it can affect everything from fatigue, sleep problems, sneezing. Basically, you name a symptom, allergies are probably involved. Most people have them. And so we're going to go real in depth. We're going to talk about them. I'm going to hang out, answer questions. It'll be a good time. Just come, spend some time with us. Come listen, come talk, come get your questions answered, and let's find out what is going on with you and how we can fix your problem, or your friends, or your family, or whoever you know.
You know, the biggest problem that I see so often is that people think that an allergy reaction is a runny nose, or they cough, or they got a headache, or they don't feel good. But the thing of it is, it breaks down the immune system, and your body just doesn't work the way it's supposed to, so you become more exposed. 703-698-7117. That's how you register for Dr. Matt's class. We'll see you next week. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.